Welcome to the Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome to the Consult Before the Cut. This week, we are getting into a something that's getting a lot more attention here.
Hot topic.
I know it's a thing. I'm starting to see it on the TikTok again. But we're going to talk about everything is on there. We're going to talk about Masseter Botox, the power of Masseter Botox. And to talk with us today, our expert, we have with us the lovely Amy.
Amy Romagera.
She's one of the injectors over at Weiler Plastic Surgery Group. And this is something that she knows all the things about. So we are going to just grill you on the next.
Tell us a little bit about yourself first.
Yep.
Yeah.
Amy, credential yourself. Who are you?
So I'm Amy Romagera. I am a nurse practitioner that has been with the amazing Dr. Weiler for going on 7 years.
Yeah.
Wow.
Yeah.
So
You're a vet.
it's
You're a
amazing.
veteran. You're a veteran of the aesthetic industry. You really are.
But you're also awesome sauce mama. You, the cutest, just the cutest.
Could eat him.
Little cheek.
Edible.
He's
He
the
is
cutest
ooey,
ever.
Gooey, edible David
He's
Michael.
fantastic.
New mama, still,
Yes.
learning how to navigate life as a mom, as a amazing
we
rockin'
do that
MP.
forever, right?
No, it's forever. It's ongoing.
fun.
It's
Nobody
just
knows what
ongoing.
they're doing.
Right.
That's fine.
Absolutely not. All right, so we are going to talk about Masseter Botox. So this is Botox placed in the masseters, which is going to be in this jaw-ish area.
Well, for our viewers, so some people may have a little bit of confusion exactly what Botox is, right? So
I was going to say, let's take it back.
Let's
He always
take it
says,
back.
take it back.
Let's take it
let's
back to the
explain it
beginning.
from the base. Who wants to take this one?
Yeah,
Taylor?
and I would say there's so many off-label areas for Botox. Amy, tell us the FDA on-label areas.
Well, hold on. Tell them. So Botox is botulism toxin, right?
Take it back.
Take it back,
Take
right?
it
So
back.
people, so it's a box. It's a substance, and there's a bunch of different brand names of it,
That's right.
Dysport, Botox is the OG. What's the other one?
Jeuveau, Daxxify.
Daxxify. There's a bunch of them. It's
Xeomin.
And what do they do, Taylor or Amy? Speak
Okay,
up, 'cause
so-
you guys are the experts on this.
Yeah, you explain it.
Yeah.
You be the expert.
Yeah, just basically what is the botulism toxin?
Mechanism of
What does
action.
What does it do
So
to the common person? You don't have to get.
So it basically relaxes muscle movement in the face. It relaxes the contraction of the muscle. Cosmetically to smooth lines and wrinkles. But there's some other off-label uses.
And
of it.
Botox can be used. It's used everywhere in the body. We have lots of muscles in different areas of our bodies. So, it can help relieve migraine headaches. It can be used in the intestines, in the stomach, but
The vagina.
in the vagina,
Yeah.
in the rear end.
We had a patient who used to get Botox injections in his vocal cords.
Yeah.
Vocal cords,
It's
cerebral palsy.
Yeah, it is literally like one of the world's most incredible, diverse substances. It's the world's most popular aesthetic procedure, right?
Yes.
We primarily use it in our industry to relax lines and wrinkles, right? But today we're going to talk about a pretty specific use of it into our masseters, right? And somebody explained to me better than I can talk about the masseters, because we're obviously this is audio and video, right? So how do you explain masseters to y'all's patients, Amy, the masseter muscles?
So I actually explain the masseter as a big baseball type muscle right here at the angle of the jaw. It's a muscle of what they call mastication or chewing that helps, when it contracts, it helps you chew, right? A lot of people will hold tension in that muscle due to stress, sometimes unconsciously in their sleep. And they will have something called bruxism, which is grinding your teeth at night, which can lead to long-term broken teeth, protrusion of the gum line. But in a general sense, it helps you chew.
It's a large muscle, right?
Right.
And it basically attaches. If you're watching this from the cheekbone area, there's a ridge of bone right here, basically, that makes our face, and it comes off below, and then it comes down and it attaches to the
mandible
to the base of the jaw. That's kind of what the angle of mandible is, and it moves it's our main movement of jaw up and down, right?
It's a necessary function.
Absolutely.
But whenever we use it too much, just like working out a bicep too much, or using the muscle repetitively, especially with clenching and grinding and TMJ issues, that muscle actually grows, and it grows to a point where it can affect you cosmetically, but also the life-changing part of it where we come in is that it can affect the medical side of the pain that patients hold
and I think of it as a muscle, like people get massages because they hold stress and tension in their shoulders, right? A lot of people hold stress and tension in their jaw, right? Like, you're, I don't know, like I'll use my kids. So like my kid comes home and we studied all night and he got a D on the test, and you're like, clenching your jaw. Like, you knew this last night. What did you do? You're really making me mad, right? So there's lots of instances where we clench, and everybody's different, right? Some people don't hold any stress in there. Everyone has stress, but some people hold tremendous stress, right? And a lot of that stress can come out in multiple medical issues. I think you guys, it's a huge shaper of the face aesthetically.
Absolutely.
Right? And it's also a huge source of tension and stress holder that can then cause true chronic medical and dental issues.
So what is TMJ, Dr. Weiler?
Well, that's a tricky question.
Why
so hopefully my sister and brother-in-law are watching this.
Yeah, right.
We actually had this conversation when we went skiing together, and my sister is getting into this. Anyway, so TMJ, it's a joint, right? Your mandible is on a sort of a hinge type joint, floats from your skull, and it's a joint that is lubricated. It has a little disc in it, and it allows your jaw to move in a very free fashion that's really quite amazing. But it's that essential large joint, and it's held in position by masseter and a few other muscles. But the primary muscle of mastication or chewing is your masseter. And TMJ can be a source of a lot of problems in a lot of people. The masseter combined with TMJ can get you in trouble.
But why do you call it TMJ if it's the temporomandibular joint? People say I have TMJ. Well, that's just the joint that you see what I'm saying? They're having an issue with their TMJ, the temporomandibular joint.
So I'm not an oral surgeon or dentist. He's
like, shut up, Taylor.
I know, but
It's like, I don't know why they call it that. They just call it that.
But you see what I'm saying?
But it would be TMD, which is
temporomandibular disorder.
Right.
Okay.
Yes. Or dysfunction.
Right. And some people have actual joint joint issues.
Yeah.
So there used to be actually at LSU in Louisiana, they did a lot of TMJ replacements, almost like knee replacements. And then it kind of got the guy doing it, the joint didn't hold up that well. So there were some issues with that. So the question is it a joint disorder, right? Like your actual, like you have your knee joint, right?
Yeah.
So people do knee replacements. Or is it a muscular,
like an inflammation?
functional? Well, is it a functional muscular issue, right? And then, or is it a teeth issue? That's the other equation. So, when you have this disorder, it can be the actual joint itself. It can be the sort of musculoskeletal system, which we can address. And it can also be the alignment of your teeth.
That's right.
That's causing some grinding. So, we're going to get into this. We can help Obviously, I'm not an oral surgeon. I would never replace a TMJ joint. And to be honest with you, I don't know if they still do it. I'm not that in tune. I know it's a possibility. It's sort of one of those things that comes in and out of vogue. Certainly, we can affect the shape of the face, and we'll talk about that, and also the functional disorder with our toxins, our Botox, right? That's our toolbox. And then dentists can certainly also do some of the muscular functions. They're not going to be as aesthetic.
And mouth guards.
But they can affect. But dentists are more mouth guards. They can actually align your teeth better. They can grind your teeth so they sit better. There's lots of different things that they can do. So I'm gonna have to get my sister in here.
I know. I was about to say. I feel like she needs to be a guest.
Our
She's
next
gonna, me and her are gonna argue though, because brothers and sisters.
And
we
just
both,
like the whole time, like we just really need you to break down TMJ on why they call it TMJ and not TMJ disorder. Like the whole episode.
I'm sorry.
No. Okay, so we have it. So the masseters are, that's what we are treating here. So,
and some people have big, strong masseters.
Yeah.
Right. I have a stronger. I mean, if those of people that are watching, Amy's got a very
dominant,
angular look, which is beautiful. My wife has a very strong masseter.
I don't.
You're not a huge, strong masseter. Right, and Taylor.
These are our no stress people over here.
Not true.
But
this is how
carry
stressed
it
out.
in a different area.
Yeah, you just carry it exactly
We just
right.
carry our stress a little differently. It's still there.
So the masseter, I would say we have been treating the masseter forever with Botox, but I do feel like in the last
I would
3
say
years,
2 to 3 years,
it's a little bit more talked about.
Yes.
In the realm of obviously the aesthetic appeal, the aesthetic side of it, but also medicinally.
Right.
With some dentists, not a lot of dentists, but
it's a niche.
Yeah.
You've got to go to a certain dentist.
Right.
TMJ disorders are a niche, and then also like to talk about like the grinding and all that. There's we're in Baton Rouge here, so there's one or two guys that really specialize in that. But in terms of the aesthetics, there's you got to be careful.
Yeah.
Yeah.
So Amy, I would ask you this if you would agree. We do tons of Botox and tons of off-label Botox.
Yes.
Do you agree that treating a masseter is the most life-changing
1,000%.
easiest thing that you do for your patients? And they're like so grateful.
Yes. And come back and sometimes tears of happiness of, oh my gosh, this is the first time in years that I've woken up without a headache.
Yes.
Or jaw pain or, they're able to sleep for the first time,
Sleep is a
in
big
a
issue
long
with it.
time. Yeah. I mean, sleep affects every aspect of your life. So it is very life-changing. And once a patient gets masseter Botox, they will always get masseter Botox. Yeah.
Correct. So taking it from an aesthetic side, you have a patient who comes in who has a very square face. What are you explaining to them? Why are you even bringing up masseter Botox to them?
So a patient will come in.
A female okay.
Patient will come in. Yes, because males, obviously, you want a more dominant jawline, right? But a female will come in and they're not necessarily asking for masseter Botox, but they're asking about what they call facial slimming, where they're wanting more of a heart-shaped appearance aesthetically.
Or they're just saying, I want to look more feminine, more youthful, more refined.
Would you use the word softer? A softer look?
Right.
It's that hard edge.
Angular.
Right.
Yeah. Right. And just where they're a little bit wider at the bottom. If you come in, you assess them, and sometimes you can watch the patient animate and you can just see the masseter pop out
It's like
at the jaw.
flexing.
Yes.
Bicep.
Yeah.
It's crazy.
Yeah.
That's what it's like. It's
When
just
mine are
constantly
not-
working out.
Yeah. When mine are not treated, you can actually see my masseter. If I'm at the gym working out, I'll hold a lot of,
Not only are you
Grin
working
and
out your
bear it,
biceps, but you're working out your
and it's
masseter.
like, boom, I'm like, okay, it's
Muscles
time.
from nose to toes. Just really getting into it. Really taking
We're getting
advantage of that
into
gym
it.
time.
Yeah. So it's a great, aside from the functional, benefits of it, it can help slim the lower face and give you a more feminine look.
I like to
Yeah.
explain to patients, you want your upper face starting at your temples to your outer cheek to be the widest area on your face. And then you want it to naturally come down and kind of slim, that upside down triangle. And so debulking is the wrong word. Removing some volume from here and adding volume here helps with that contouring of the face.
But, okay, when you say, so you're taking away from the
volume
chin,
there.
You're talking about around the chin area and then slimming and around the chin because you're like here and here.
So,
No.
What were you just said like from here and here? I was trying to like just for the people that are listening.
Slimming here,
which is you're talking about
Masseter
the Masseter
Botox
area.
So, well, be exact. All right. So your cheek area, you want a lot of volume, right?
Correct.
And so you want
not a lot of volume, but
well,
yes,
you want good volume, right? And you want a lot. You want width, right? You want that area right below your eyes should be pretty much the widest part of your face.
Yes,
right?
correct.
And then as you go down lower, right, into your jawbone area, right, that area in some patients, the masseter, and we call it the angle of the jawbone, right, the angle of your mandible back here, and it's a very powerful muscle that gives you a very angular look. And so, like, if you look at like it's kind of a more masculine look, right? So I don't know. I'm trying to think of like a famous movie star.
I was also trying to think of somebody who's got like
Brad Pitt has an incredible angle of the mandible, right? A lot of these models that you see, they have super strong masseters and super large angle of the mandibles. And so some women, in my opinion, look really good with it. Some women look really bad with it. I think it depends on the other proportions of the face,
That's
right?
right.
And like you said, as long as you have really good facial width, I think you can get away with a strong angle.
That's
down
right.
there, right?
And that's true. I mean, when you slim the lower face with the Botox, you have to consider other areas for balance, right? So what you were kind of indicating was what, filler to the chin, even sometimes filler to the mid face, right? To give you that proportion here in the mid face and also proportion here. And not just, you know, if you're deficient in your chin, right, you have to be careful with Masseter Botox because it can create worsening of the jowl appearance.
10 years ago, I treated his wife because she has very strong masseter muscles.
Because I stress her out all the time.
And we were going for facial slimming.
Yep.
She didn't have crazy TMJ issues, but it was more of like for the aesthetic appeal. And she despised it.
Yep.
And we never did it again because whenever you remove volume here, it can, in some instances, worsen the jowling, what she was saying, because it doesn't think of it that the masseter is occupying that space, right? So if you get rid of that, occasionally you can see a little bit heavier here. So you may have to involve filler.
But you know, it's interesting. So, she's gonna kill me because I'm talking about. But so she's always had a very like you have a very dramatic jawline. She always has too, very thin, and it's sort of her look, right? And so 15 years ago, she didn't have TMJ issues, right? And she really liked the appearance. So she went in, we were just starting to use it, and you did change the shape of her face, and she did not like it. Well, recently, she's revisited it a few times because she is having
with her
some jaw issues,
Yeah.
right? And she'll try it, and then she remembers how much she hates it.
Yes.
And now she's like, I cannot do that because I don't like the way it makes me look. So it is a very, very powerful slimming of the lower face, which can make a huge difference one way or the other. And I think that is, really the telltale. It is very different than medical indications, right? Now, if you have a very strong masseter and a very angular jaw, and you have TMJ and you don't want that look, it is a perfect marriage, right?
Right. That's
and
right.
those are the patients that you're talking about with life-changing experience.
Yeah.
Right?
And okay, so if it's a medical situation and they are feeling terrible every morning, they're clenching, they're grinding, they're having headaches, they're having ringing in their ear, they're having, that awful jaw pain. I had a conversation with a patient this week. I'm like, listen, the risk is we're going to fix your medical issues.
Right.
You may have a little bit of elasticity changes here that we can fix with filler.
That's exactly right.
And she's like,
We have
do
other tools.
anything you want to fix my medical
Yes.
And then we can
And then we'll worry about
tighten
it.
skin.
Yeah.
I mean, I've had patients come in that have cracked through their mouth guard because
crazy.
they grind so hard, and their dentist doesn't offer
Right.
Masseter Botox. I mean, if you're grinding so hard in the middle of the night that you are cracking
Your mouth guard.
That's-
guard,
And if your
that's
mouth guard is
impressive.
there, they're
insane.
ruining their teeth. They're cracking their
Yes.
teeth.
So,
Yes.
so someone comes into you in your mind, Amy. Who is your ideal Masseter Botox patient?
For these patients that are coming in that, and sometimes they come in asking for Masseter Botox specifically because they've heard it. You know,
They've
I
seen
didn't
it on
know
the
that you could
TikTok.
get rid of my headaches,
Right.
these chronic headaches that I'm having every morning, or even throughout the day. They come in and you can see it. You can see the bulk of the muscle. I'm like Masseter Botox all
Yeah.
day long.
Or you'll ask them, do you clench or grind if they're getting like upper
Yes.
face Botox? Do you hold pressure here? And they're like, yes, I do. And then when you
Yes.
tell them there's a solution, they're like, what?
Get it.
Yeah. And then they come back to you 2 weeks later,
Yeah.
and like I said, they're sleeping for the first time. And
Do you
Yeah.
do equal parts male and female? Does it sway one way or?
so I don't know if I've ever really treated a
Man.
male's
Yep.
masseter.
I have treated a male who was very asymmetric. And so we were working on facial balancing
Right.
for symmetry. And so it was filler at the same time.
Okay. Yeah, because most men are wanting
Men
to
want-
enhance
Yeah,
the masseters,
that's right.
There's,
Yeah,
that's
there's
right.
actually implants that you can do to enhance that area. I don't do them, but oral surgeons, they do have implants that you can slip in there to make it a lot more angular. for
I'd be
men.
curious to know if TMJ disorder is more prevalent in women versus men.
I would say yes. I don't know the ansor.
Yeah.
Bring
you know what I mean?
your sister.
I know.
All right, I
Can
will.
we-
I
know.
really don't know that. That's a
I
good
know,
question.
but you know the way you say you're treating females most of the time. I wonder if it's just more prevalent there.
yeah.
Certainly probably more stress.
More stress.
Yes.
Ladies get a lot more stress than guys.
I always say I'm
do.
going to come back a male.
That's right.
Always.
There's that. Oh.
Now,
I mean, my goodness.
anybody who do you turn down? Is there anybody that you turn down that for masseter? Is there anybody that's not appropriate for guys?
I think what Taylor was talking about earlier is that it's more so of a conversation, right? Of, okay, if we do this, you know, speaking of Masseter Botox, and they are already
Heavy.
predisposed,
Yeah.
you know, heavier in their jowl area, then we just have to be cautious. And
Right.
like I said, there's other tools in our toolbox that we can utilize to help contour the face and still give you the sharp jawline that most people kind of want, by balancing the other proportions of the face, like the chin, the anterior jaw, to help camouflage that jowling.
Okay.
Yeah.
Let's talk technique.
Yeah.
Okay.
Okay, so I come in. I have terrible TMJ, a huge masseter. Walk me through what that looks like.
Okay, super easy. Just like other areas of Botox, right? We wipe you off. It's anywhere from probably 3 to 5 injections per side. It's a deeper injection there. And this is why also I tell people it's super important to credential who's doing your Botox. There are other muscles that attach into the masseter that can impact your smile.
Yep.
So you want to go to somebody who knows what they're doing.
Yes.
You know,
It's just not a blind stick in there.
it's
You
not a
gotta know
blind
landmarks,
stick. You have to
right?
be, you know, there's landmarks and things that you're looking for to make sure that you don't impact the smile. But it's very quick. I mean, I would say 30 seconds total from start to finish.
And don't you feel sometimes they are like, it was therapeutic, just the injections? It's
Yes,
like dry
it's almost
needling
a
or something.
release.
It's a
Yes.
release whenever you inject
Releases
the
some of that
Botox.
tension in
That's
there.
it.
Yes.
Yeah.
Yeah.
I mean, it sounds, like you
Yeah.
said, like it sounds like that therapeutic
amazing.
feeling that you'll get from it.
How many units do you usually do, or do you have a preference for a brand? Or
So that's a good question. So I guess it depends on the strength of the masseter, the look that we're going for. Is it more so, are we treating functionally or
Right.
are we treating for facial slimming? But the masseter is a big muscle. So typically it's a higher dose. I would say average of 20 units per side on average, depending on what the strength of the muscle is.
Do
and
you
the look
guys
we're
get
going
more
for.
aggressive when you're treating function over aesthetics, or you do?
Yeah.
Okay.
I would say so, yeah.
This lady I treated Monday was 50 units, and she probably could have used more.
Okay.
So,
On each side.
total.
Oh, total.
I did 26 and
That's it.
24 because she was strong on one side. But I will say it is a pretty hefty dose in the beginning. If they stay
a good
consistent every 3 months,
Right.
you, I think, said this or taught me,
Yeah.
if you don't work out your bicep
Yep.
for 3 months, don't work out your bicep for 3 months. Don't
That's
work
right.
out. It is going to weaken. It's going to atrophy. It's going to
Yep.
shrink. It's going to require less Botox
Or longer intervals.
and longer.
Longer
That's
intervals,
right.
you're exactly
And
right.
And
it's
you're
not
still
gonna be-
reaping those benefits for a longer amount of time
Absolutely.
in
yes.
the middle,
Absolutely.
which is really where the
Yeah. That first
where the
one's
great
gonna,
thing is.
That first one's going to be your high dose.
Yeah, but
biggest
I mean,
relief. And
that's
then as you go,
$560.
Yeah.
It is still affordable
To
if
change
it's a
your life and to
life-changing
sleep
device.
for the
yeah.
first time.
Just
Yeah.
huge.
You wouldn't believe the amount of money I'd pay for a night's rest.
Yeah.
Yeah.
Right.
Especially this morning, right?
Especially right now.
I'm like,
Give you
man.
$1,000
Where's
to
the
go sleep.
coffee?
At minimum.
Where's the coffee?
That's right. There isn't enough. I love that. So,
Aftercare before we go
yeah,
on.
that's what.
Yeah.
Yeah.
Aftercare, and then we'll cut to a break.
Yeah.
Don't massage the area. Just leave it alone. Don't exercise. That's really it.
upright after. Yeah, that's
yeah.
just the day of. Just
Just
go
the
about
same
your day,
thing.
low key, upright. Carry on.
Yes.
Good.
It
Like
is
on a side
zero
note,
downtime.
like, is this how Dennis got into Botox?
Yeah.
I'll
Right.
be shocked. I think more dentists would do Masseter Botox than they do. Do you? Are you always shocked by that?
Same, yes.
But you know,
I
I'll be
totally
like, oh, I
agree.
go to my dentist for Botox. I'm like, how did they get into that, Masseters?
Yeah.
That's what I'm,
Maybe. I don't think so though.
No, I
No?
think it's just.
See? I'm like,
we'll have a discussion with my sister, but
like totally
no,
offset.
I think some dentists are a little bit more fearful of the masseters. So I don't think it's every dentist out there is doing masseter Botox. It just they do kind of specialize in different.
Like you
things.
said, they're more like the mouth guard and stuff like that. And then that you can go to somebody.
Yeah, and cost. They probably will do
Yeah.
a masseter once a week or something,
Correct.
and then it would expire.
and their
So it doesn't
toxins.
make
That's
sense.
right.
They don't
Yeah.
get enough volume. So
Oh, cool.
we're going to cut to a break real quick and
Yes.
then bring in our other special guest, one of our patients, right? I want to thank our sponsors, Weiler Plastic Surgery Group, the largest aesthetic plastic surgery group in the state of Louisiana, and also Rejuvime Medical, Louisiana's largest anti-aging clinic. They specialize in GLP-1s, hormone optimization, TRT, and a little bit of aesthetics. So we'll be right back, guys.
My name is Casey. I live in Hammond, Louisiana. As I was approaching my 30s, I started to notice a few wrinkles here and there. I just wasn't happy, so I decided to make a step to change it. I've always known of Dr. Weiler's practice, and that was always my first choice. The first time I've ever been here, I was a little nervous, but once I got there, everyone was very welcoming, made me feel at place, and it's made me look visibly younger. I have more of a confidence boost. I feel better about myself and in my own skin.
So my hair had started falling out about 8 months before I saw Holly at Rejuvime. I had seen my regular doctor and he told me everything was normal, but my hair was falling out, so I knew everything was not normal. When I went in to see Holly at Rejuvime, she gave me all the information that I needed and told me the benefits, how it would help. It's not brittle and frail anymore, and it looks much healthier. It's not just about what's going to happen today or tomorrow. It's about years forward.
All right, guys, welcome back. We have got our patient here with us today, Miss Kira. Thank you so much for joining and kind of telling us how you got into this Masseter Botox world. But before we get there, kind of tell us a little bit about yourself.
Well, thank you so much for having me. I've been getting Botox now probably for about 7 years, mainly upper face, for a couple of years. Amy has been my injector. And I kind of came in one day and I was just telling her like, gosh, like I've been having like these terrible headaches, my teeth have been hurting, and I never in a million years, thought that Botox could help that. I didn't even know that that was a thing. So yeah.
So she mentioned the masseters that day.
She did. I didn't even correlate the two. You know, you go in, you're talking to your injector, you know, like they're like your friend.
Yeah.
You know, I was just like, gosh, like I've been, you know, struggling so bad, like with my, you know, my teeth have been hurt and I've been going to the dentist, you know, had the mouth guard, the whole 9 yards. And she was like, oh, well, did you know?
So you had already
Really?
gone. So you've gone
So you
to
had
the
a mouth
dentist.
guard. You
You
had
have a
everything.
mouth guard. You've
Yes.
gone to the dentist. All of the things, and oh my goodness, I didn't know.
And it was
I
never mentioned
never
along
mentioned
the
that
way?
you could.
No,
Really?
not at all.
How long you had the mouth guard, you think, roughly?
Probably about 6 months.
Okay.
So it was fairly new, and it was like one of those things, like you kind of just, it's like gradually happens over time. You're like, what is happening? What's going on? You never had these problems before, and then you know,
Did the mouth guard help?
it did, but only for like a period of time. It wasn't like extended relief.
Oh, okay, so it was just maybe like waking up not feeling as bad. But
Yes, it
throughout
wouldn't
the
be
day,
as tight, but then throughout the day, I'm like, oh my gosh, what is happening?
Yeah.
So okay, so you were coming at this not from a facial slimming or something like that.
No.
Did you have like the square thing?
Yeah, did she have a real powerful,
Yeah.
She
powerful
did.
masseters?
I did.
You
They're actually, I signed a release, and I have the photos on the
Photo
website.
Oh, really?
If you
Okay.
want to
Yeah,
go check that out. Yes, it is.
Yeah, we'll put
Sure,
those
we'll
up
put them
too.
up there.
Those in
Yes,
there.
unbelievable.
It's a big difference, and it was one of those things that you don't really notice before, and then afterwards, I was like,
Oh, wow.
my gosh! So it's one of those things you do it, and you're like, oh, yep, never going back.
Yeah.
Yeah, that's right.
So, do you feel like your masseters were large because of stress, or just that was your anatomy? Like your family has large masseters?
I think it was a little bit of both. I'm a pretty anxious person, so I definitely think, you know,
Same girl.
at night, you know, you clench and then
Yeah.
you grind and you don't really realize it, and then
You're laying there and you're like, what did I forget? What do I have to do tomorrow?
oh my goodness,
The
Who did
spiraling
I
out
kick
of
off
control.
today? Oh, she's
Yes.
mad at me.
Well, I just lay there and go, I just fall asleep.
Men.
Men in another life. In
Yes.
another life.
We love that for you, Dr. Ryan.
So that's it. I mean, okay, so how long have you been doing the masseter Botox?
I'd probably say about a year now.
Mm-hmm.
And like y'all were mentioning earlier, it's one of those things where I don't have to get it as often now.
That's right.
So, you know, cost wise too, you know, it's amazing outlook on both, you know.
Yep.
We did it consistently probably the first 2 times. And then
Do you remember what her dosing was whenever you treated her?
I mean, I cannot think off the top of my head, but I typically will start around 20 units
Okay.
Per side. So
per
45.
side. So 40,
Okay.
roughly
Yeah.
40 units total
And-
to initially treat it.
We're going to be showing the pictures, but when she came in, when you had that conversation, what was your thoughts? Does that sort of make sense? Like,
So Kira, if you're watching on video, is precious, right? She has a younger face. But when I first saw her, obviously she was in there for upper face cosmetic Botox.
Right.
But she was mentioning she was under stress at the time.
Right.
And she was like, I'm just getting these headaches every morning. She was fatigued. And you could look at her face and see that she was kind of boxed out at the bottom. And so I mentioned it, felt it. I'm like, you'd be a great candidate. And so we did it, and it changed her life.
Wow.
I
You
think
know?
your exact words were, oh my gosh, it's like a baseball.
Yeah.
I was like, oh, cool.
Yeah, it's like a big hard baseball. That's right. But I kind of want to go on your journey a little bit because we had talked about this previously. Tell the audience kind of what happened after you got and the muscle started slimming. Explain what you started to notice.
So as it started to get weaker, and as I'm getting older, love that, I started to notice this part was kind of
12.
jowling a little bit. So we did scale back. So it is a concern as you age. But then we started doing some filler in my cheek area and my chin, kind of help balance that out a little bit. So, you know, it's like a kind of give and take. You get relief for this, but there's always a solution for this. So I think it kind of, you know, put me in that journey to the filler world as well.
when did you notice the physical aesthetic changes after? So how long did you notice the functional, like, hey, the relief? Was it immediate? Did you experience that like dry needling effect that Taylor was talking about? Did it take longer? And then when did you sort of realize that it was changing your shape?
So the first time, I will say, a couple of days afterwards, it does feel a little bit tight because you're so used to clenching. So it's, the opposite drug. So I did notice a little bit of tightness in my jaw, but then once the relief started to kick in, I think it was probably about day 5, it was completely life-changing.
Really?
It was crazy.
I say you
I
will
slept.
you will feel that you can't clench and grind as hard around 5 days to 2 weeks. 7 to 10 days is usually what I say. But then you will not notice the visual changes. I see patients back usually if it's for facial slimming at 6 weeks. And that's when you can really start to see the facial slimming. And it gets better each time that you treat. It is not life-changing facial slimming in 2 weeks. It does take some time for that muscle to kind of weaken and slim
But that's
down.
still, I feel like that's still was 6 weeks after on a muscle that you've been working and working and working. 6 weeks is not that long of a time before you can start seeing those aesthetic results from it as well.
Mine was the opposite. I came in there for the relief, but then, the perk of the facial slimming. And I didn't really notice until we did that side by side when I came back after 2 weeks.
Ooh.
And it was
significant.
Yeah.
Yes.
It was pretty incredible.
I can't wait to see the pictures.
Has your what about your dentist? Has your dentist noticed? Have you?
Yes. So I still wear the mouth guard,
Okay.
because you're just so scared. I'm like, I
Right.
don't want it to come back. But yes, he did say that it has helped tremendously.
That's awesome.
That's what I said. And keep the mouth guard for like pure sex appeal.
And you'll notice, you'll know when it starts to wear off.
That's like I'm doing the mouth taping, and that's real attractive too. Plus, you can't talk. So.
Oh, man. Okay, so you said after your Masseter Botox, you did have some kind of little extra. We're just going to call it extra skin. A little extra skin on the bottom. But that was a quick, easy fix. You and Amy talked about it, worked it out, and then y'all just went back in with it sounds like a great balancing plan.
And we have talked about this a lot. I would not say this is the majority of patients that have jowling.
No.
It is a very small minority, but it is a side effect or possibility. And so we make that game plan. I am telling every patient, I actually talk about his wife, that experience. I tell every single patient that, but it's a very tiny amount of people that happens to.
Yeah,
But
it's
it's
just
so great that
important
there's a fix.
Yeah, it's exactly right.
Education.
It's important to realize that if you're having the functional, effects of headaches, I'm not sleeping, breaking through the mouth guard, et cetera, we can treat the functional side of it. And if there's an issue with facial balancing, then we also have those tools.
Yeah,
I
that's
love
good.
that. I love that. I'm just, you think about how many people have just lived with jaw pain.
You should see how enlightening and eye-opening it is whenever you mention to patients
like,
that there's a fix. What tell us emotional? What has it done for you daily? What would you tell?
Just like Amy said, sleep affects your entire life. So if you don't get a good night's rest, it sets you up, for failure the next day. So it really has helped my mental clarity as far as sleep-wise, emotional. If your head is pounding all day, every day, it can be very taxing, very mentally draining. So it has definitely helped in those areas for sure.
I love that.
That's wonderful.
You would think like living in South Louisiana, you're like, oh, I have headaches, and it always I feel like it always kind of gets brushed off. Oh, it's probably sinuses.
Allergies.
It's allergies. And then you go into somebody like in the aesthetic world or something, you're like, oh, ma'am, like, no,
There's more
jaw.
to it.
Yeah,
Well,
there's so much more to it.
I think it's just like realization that stress it can be physically manifested, right?
Yes.
And then it's sort of like this death spiral of one thing starts and then it causes you to have a bad day, then your next day is worse, then your headache. So it is stress is real. Stress manifests itself physically and differently in lots of people, and certainly this is a huge area that I think people carry a lot of stress in, and it causes some physical damage.
My question, I always ask this because I'm, like the wuss at the table. I'm like, does it hurt? Did it hurt when
No. So I mean,
And
like
Kira's
I said,
a big wuss too.
I am.
Well,
I am.
hey.
Self-professed wuss.
Someone holding my hand. I have Goldie. I have someone tapping. All the things.
Sweating. Just
Yes.
like, oh gosh.
Amy's like, okay,
That's
take
it.
a deep
It's
breath.
gonna be fine.
Yes,
Yeah. I mean,
exactly.
Count
Hey,
backwards from 10.
There you go.
It'll be over in a second.
For those of you listening who never had Botox, it's done through a tiny
Yeah,
little
it's
so
bit.
Itty,
tiny.
itty bitty.
So tiny.
Yes. That muscle is so big, and it's not very many pokes. So I would say it's very quick, easy, totally worth it, no matter what.
Okay, so you're saying, I mean,
It really
good to
is
go.
not bad. And
No.
I
It's not.
am also a
I know
wuss.
this
It
is
not bad
a table
at all.
of
That's
very
these are all
sensitive
facts.
ladies.
Yes.
I think I'm pretty tough.
I will
consider
ask
myself
Sean
tough,
about
too.
laser hair removal and soft wave.
Chocolate stuff.
Oh, okay.
Well,
all right.
anything else
I know, I'm
to?
trying what would you tell? Like,
Yeah, what would you tell?
What would you tell all of our listeners out there who are wearing the night guards but still having the pain and the headaches and stuff and everything associated, just like you were?
Yeah, and some people I think are like, really afraid of medicine or afraid they hear the word Botox, right? They hear the word toxin, right? And I think fear is what keeps most people from seeking results, whether it's to improve themselves physically, aesthetically, or medically. People are afraid. What would you tell people? Because you're a self-proclaimed wuss. So.
Yes, for sure. I would honestly say just do it. There's, always the chance of it not working. There's always the chance of it working. I mean, at that point, when you're in so much pain, I mean, just try it. It was completely life-changing for me. I was kind of hesitant with Amy. I was like, oh, this isn't going to, help my problem just because you're so down bad about the pain and the stress. But if there's a solution and this is a solution, I would definitely just say try it.
Yep.
Yeah. What's it? We always talk about Botox. It'll wear off in
Yeah, I was
Yeah.
about to say that
Yeah.
as well.
Yeah.
It wears off, and then if you don't like it, if you, say that you don't like the appearance of it, like your wife
That's a good
didn't,
point.
it does go away. It's nothing
Yeah.
is permanent. But it's
The muscle will
definitely
bulk right back up.
yes, it will go right
Take
back.
care of
But
Get that nice jawline once again.
yes,
That's a good point too. Y'all had mentioned, fears, right? And
Right.
another fear is the cost of it. Taylor had mentioned earlier, it's, right over $500. You think about the cost of broken teeth,
Yep.
root canals, nerve damage to your, that's a whole lot more expensive, long term than.
Poor sleep. I mean, the loss
Right.
of your time and joy out of your life. I mean, I think fear, when you talk about whether it's aesthetics and the fear of people are going to not. You walk in the door and you give people your complaints of jaw pain or lack of sleep, and your provider is going to blow that off. Fear of not being heard, I think, is also fear of being embarrassed. I think fear is such a driver of what we do in our lives, and it's certainly a huge issue in the medical world and the aesthetic world. It really is.
I would say I love this topic because we treat a lot of areas with Botox, a lot of different, concerns. But I will say our Masseter Botox, and I'm sure you can agree, are the most grateful, loyal patients
1,000%.
that you have.
Period.
Truly. Yeah.
Yep.
So, yeah.
Great way to
I
end the
know.
podcast.
Yeah.
There it is. All right. So with that being
Come in for your
said-
consultation. We can chat.
Yeah, we can talk about it. Make an appointment with these lovely ladies.
And
here.
let us change your life.
So thank y'all so much for joining us today. Amy, thank you so much for bringing your expertise in this situation, as well as Kira. Thank you so much
Yes.
for bringing your experience in this. And thank all of y'all for joining us today. Make sure to subscribe.
Subscribe
Make sure to
below.
subscribe.
Follow us.
Follow us on all the platforms,
Yep.
all the things. Always stay curious, always stay informed, and always remember to consult before you cut. We'll see you guys next week.
Thanks, guys.